Nurses are not the best when it comes to taking care of themselves.
Nurses, oh my gosh. We're overworked and we overeat.
Not because they don't have a desire to eat well. When they're at work, they don't have time to eat well.
We grab, shove, and run. Not the healthiest.
When you're in the hospital, usually you're eating the hospital food, and I don't recall that being very healthy.
And it doesn't help that our patients are so sweet and bring us little chocolates, like this big of chocolates. So
they're thanking us for giving their family such great care, right? So they're bringing in the donuts, they're bringing in the cookies.
So not only do you get it from patients, but what really needs to change, in my opinion, is the way nurses eat when they're in the break room. It's a disaster. You have a box of donuts, you have bagels and cream cheese, and you have a lot of caffeine and a lot of soda to get you going. Your three basic food groups for a nurse are donuts, bagels, and Mountain Dew, and that's about it.
In nursing school, we got 1 semester of nutrition. That's it, which is more than the doctors get. I think they get 4 days, so.
Not enough to really know anything about nutrition, to be honest with you. We had the basics of carbs and protein, but never anything truly about how eating really affects one's life.
And the connection between what we put in our bodies 3, 4, 5 times a day and how we feel, think, look.
That's not something that we really covered well in medical school. And it was a new thought.
And so many times people think it's their heredity that is making them sick, but it's really their lifestyle.
It's a lot to do with the way they eat, their weight.
So someone comes into your office and they want to lose pounds. They want to look good. That's what most people want. They want to lose weight. And what most people don't know is the best way to lose weight is to eat right. Exercise certainly can burn some calories, absolutely, but you go run and maybe you only burn 250 calories. You gotta run a lot to take some pounds off. Or you can make some small changes in your diet and get the same results.
If people would just eat better, we would have so much less sickness and chronic disease in the world today.
Nutrition is really the foundation of good health. If you don't have a good balanced diet, especially with lots of plant food like fruits and vegetables, then you're missing so much.
When you ask someone what they need in their diet, they will tell you that they need vitamins. Well, there's only 13 vitamins. There's tens of thousands of nutrients, phytonutrients.
The phytonutrients that we know about and the ones we don't know about. I think when vitamins were discovered, they labeled them the same as bra sizes. A, B, C, double D, And they're that sat. But there are so many phytonutrients, micronutrients in foods that our body needs, our cells need.
We really don't know what all the compounds and the phytochemicals do in our bodies, but we know they do something.
Our body doesn't know how to use isolated, fragmented vitamins, but when you put the whole apple, the whole cucumber into your body says, aha, I know what to do with this. I was designed to use this.
I love that the government has changed the pyramid to half a plate. Visually, it's much easier for children and adults
to get a better understanding of how much they really do need to consume, not just once a day, but each meal having half of your plate be fruits and vegetables.
There is a reason they're saying that because, every organization out there who cares about health, the American Medical Association, the American Cancer Society, all of them say the same thing. Eat more fruits and vegetables. They're obviously very important. If they're telling us to eat that many, I also feel that's very difficult to do. For most people, if they're honest.
Most are getting about 3 servings a day. For kids, it's about 1.5. With real life coming into play, it's hard to get 7 to 13 servings in most people's diet.
Either because they don't like it or because it's inconvenient or it takes a lot of time or it's expensive. So that's one of the reasons why I like to share JuicePlus is because almost nobody gets what they need and it's an easy way to do it.
Even if you're striving for that goal that we have a half a plate, you're most likely gonna fall short. And JuicePlus just provides an awesome solution to get what you're doing to where you need to be.
You do, to a certain extent, have a reset button with your own lifestyle choices, especially your choices to eat more fruits and vegetables. You can improve your health.
And altogether, there's nothing that fruits and vegetables can't somehow help.